Welcome to Global Health Hub. This channel is purposely created for health education. Today we will be talking about how to manage food poison at home. Managing a poisoning emergency at home requires prompt action and the knowledge of certain key steps. Please keep in mind that in case of a poisoning emergency, it is crucial to contact emergency services or a local poison control center immediately for professional guidance. However, here are some general guidelines for home management of poison. Assess the situation. Determine the nature of the poisoning and try to gather as much information as possible about the toxic substance involved. Look for labels, containers, or any other relevant information that can help medical professionals provide appropriate treatment. Call for help. Contact emergency services or a local poison control center immediately. Provide them with detailed information about the poisoning, including the substance ingested, the amount, and the time of exposure. Follow their instructions and stay on the line until they advise you to hang up. Keep calm and reassure the person. If someone has been poisoned, it is important to remain calm and reassure them. Offer support and encouragement while you wait for professional assistance. Do not induce vomiting. Unless instructed to do so by a medical professional or poison control, do not induce vomiting. Some substances can cause more harm if they are vomited back up. Remove the poisonous substance. If there is still a risk of exposure, remove the person from the source of poisoning. Ensure your own safety when doing so. If the substance is on the person's skin or clothing, remove contaminated clothing and rinse the affected area with water, if appropriate. Follow first aid instructions. If you have received specific first aid instructions from emergency services or poison control, follow them carefully. They may provide guidance on actions such as diluting chemicals with water or flushing affected areas. Do not administer medication or home remedies. Avoid giving any medication or home remedies unless specifically instructed by medical professionals or poison control. Certain substances or interventions may worsen the situation. Provide information to medical professionals. When medical professionals arrive or when you reach a healthcare facility, provide them with all available information regarding the poison, including the substance involved, the amount, and the time of exposure. This information will assist in determining appropriate treatment. Secure the environment. If there are other individuals in the area who might be at risk of exposure, ensure their safety by removing them from the area and securing the source of poisoning. Follow medical guidance. Follow the instructions provided by medical professionals for further treatment and monitoring. Be prepared to provide additional information or answer questions as needed. Poison control centers. Keep the contact information for your local poison control center readily available. In the United States, the Poison Help Hotline is 1-800-222-1222. Poison control centers have trained specialists who can provide immediate guidance in case of a poisoning emergency. They are equipped to handle a wide range of situations and can offer specific advice tailored to the substance involved. Be prepared. It's a good idea to have a well-stocked first aid kit at home, including items such as adhesive bandages, sterile dressings, gloves, scissors, and tweezers. Additionally, familiarize yourself with the contents of the kit and ensure it is easily accessible in case of an emergency. Recognize signs and symptoms. Understanding common signs and symptoms of poisoning can help you identify and respond promptly to a potential poisoning incident. Symptoms can vary depending on the substance involved but may include nausea, vomiting, abdominal pain, difficulty breathing, dizziness, confusion, seizures, or changes in heart rate. Stay vigilant and seek medical assistance if there are any concerns. Keep chemicals secure. Store household chemicals, cleaning products, medications, and other potentially toxic substances out of reach and sight of children and pets. Use childproof locks on cabinets and drawers to prevent accidental access. Ensure proper labeling of containers and follow manufacturer's instructions for storage. Read and follow instructions. When using household chemicals, medications, or other potentially toxic substances, carefully read and follow the instructions provided. Use appropriate protective measures, such as gloves or masks, when handling chemicals. Avoid mixing different chemicals unless explicitly directed to do so. Safe disposal. Dispose of expired medications, chemicals, and other toxic substances properly. Follow local guidelines for safe disposal, which may involve taking them to designated collection centers or participating in community disposal programs. Educate yourself. Learn about common household plants that may be toxic to humans or pets. Be aware of potential hazards in your environment, such as lead-based paint in older homes or carbon monoxide from faulty heating systems. Taking preventative measures and being informed about potential risks can help minimize the chances of poisoning incidents. Childproofing. If you have young children, childproof your home to reduce the risk of accidental poisoning. This includes installing safety gates, securing cords and wires, and covering electrical outlets. Keep small objects, including batteries and magnets, out of reach to prevent choking hazards. Medication safety. Follow proper medication storage and dosage instructions. Keep medications in their original containers, and don't share prescription medications. Dispose of unused or expired medications appropriately. Educate children about the importance of not taking medication without adult supervision. Continuous supervision. When infants, young children, or individuals with cognitive impairments are present, ensure they are under constant supervision. This reduces the likelihood of accessing and ingesting harmful substances. Remember, the information provided here is meant to serve as general guidance. Each poisoning incident is unique, and it is essential to contact professionals, such as poison control centers or emergency services, for accurate and specific guidance tailored to your situation. Prompt action and seeking professional help are crucial in managing poisonings effectively. That is all we have for you today, and watch out for our next video on management of acne. Thank you.